Cool, I think we're all set.
I'm Grace, and I am a PY3 physical therapy student.
I'm Melissa, and I am an ABSN student in a one-year program.
I'm Rebecca, and I am a PT PY3 physical therapy student.
I am Brenna, and I am a PY2 occupational therapy student.
I'm Brett, I'm a third year medical student.
I'm Elise. I'm a P2 pharmacy student.
So we are doing a project in regards to radical belonging. Radical belonging can be defined as something that can be understood to be a way of being that is never finished. It is something that is constantly being worked for and worked towards. Radical belonging entails ongoing collective efforts towards transformational change aimed at interrupting endemic racism to secure social, academic, and democratic belonging for every member of the learning community. This is especially prevalent for students of color whose belonging has too long been denied. There are three aspects of radical belonging that overlap, and that includes the first aspect being social, second being academic, and third being democratic. These three aspects are mutual constituting, and which means they enable and support each other. Our next slide. Social belonging can be defined as an ethos of care, respect, and appreciation for people fully as they are. Academic belonging is envisioning learning that is agenic, responsive, collaborative, and anti-hierarchical. Democratic belonging complements social and academic belonging. It encompasses the knowledge, skills, dispositions, and structures that it takes for a learning community to work for justice at a systemic level.
So kind of one of our thinkings through this, especially for this case, was kind of understanding each individual person is going to have a different desire, kind of understanding of what radical belonging is, in addition to like how far people want to get involved to like making change for that radical belonging. So understanding kind of the hierarchical or kind of different viewpoints and desires for involvement. We want to kind of make more of a three-tiered approach as far as, getting this information from these individuals. How can we implement that information and those desires to best kind of support, starting from the ground up, from the individual basis all the way up to the organizational. So starting off with the individual basis, and we'll go into kind of some more details in the next few slides. Starting with like surveys, town halls, things where more of a grassroots movement, trying to get as much information as possible from people from that are affected by Fairview, kind of in all walks of life, from our patients to faculty to administration to any other kind of employee that works within the system itself, kind of giving that as our basic, as our ground level, kind of going to the next step with the team facilities. So facilitated like team meetings where we can talk about radical belonging, kind of a hierarchical or a higher end approach, kind of seeing how these things affect the team as a basis, whether it be physicians, nurses, OT, PT, pharmacy, anyone that's involved kind of in that direct patient care, and how can we best assist patients and kind of facilitate radical belonging on the team aspect, and how can we best support them. And then kind of the big picture on the last one, organizational, so leaders from each team profession. So chiefs of departments, whatever that may be, charge nurses, etc. And utilizing those surveys that we took and information from kind of those facilitated team meetings and seeing how we can best implement, or kind of the overlap that goes from there to develop kind of our end goals of what is desired to best facilitate our kind of idea of radical belonging across everyone that's involved.
So these are some, I'm sorry, these are some of our interventions and the inequitable impact of COVID-19 on marginalized communities. So going off what Brett was saying, we're going to create some anon surveys in these marginalized communities, which will kind of assess the impact of COVID-19 And we will distribute some of these surveys. If, like, let's say a member goes and sees a healthcare provider, whether that be a physician, an OT, PT, pharmacist, however, which way, they would be able to advertise in such a way as to give them the survey and encourage them to fill it out so that we could better them in their community. If they are unable to see a healthcare provider, we would distribute this survey through mail. And in that way, they can also see and voice their concerns and what they have, so that we can better their overall wellness. This could also lead to having city hall meetings as well, so that the community members can gather and voice their concerns as a group rather than individual, and to really be there in person to voice their discontent with things. This could also be taking place at a church, a town hall, or a park, wherever we see that is best fit for them, or if they ever see that's best fit for themselves. So the Anon survey itself will have a section specifically relating to burnout for healthcare team members to fill out within marginalized identities, to kind of just to see how we can improve their mental health and well-being, so that they can in turn improve the members of the marginalized community. And such questions could consist of, like, asking if supportive counseling would be beneficial for those who are healthcare team members, so that we can prevent that burnout from occurring.
So to implement this, we would want to hire or appoint individuals to positions to lead the meetings and develop the surveys that were previously talked about. In the creation, or these individuals could be from inside the company at M Health Fairview, or from the outside world, which would develop a more comprehensive approach with different viewpoints and opinions. Through the creation of the surveys, we would use the results, and the appointed leaders would then assess the need and desire for things such as counseling services and wellness programs to be implemented for all individuals of the team. With the town hall meetings, we would also want to appoint leaders for those meetings as well to run them. And we would also schedule weekly interprofessional team support meetings to discuss radical belonging as it relates to each individual's role. This would also be a way in which an interprofessional team can help to support the implementation. And then we also have some short-term goals and long-term goals. Our short-term goals would be to develop communication pathways for all parties to gather information, opinion, and feedback, as well as assess opinions of radical belonging and the impact of COVID-19 through the surveys that were mentioned. And our long-term goals would be to decrease healthcare disparities amongst all populations, and decrease burnout and improve mental health and wellness in individuals at M Health Fairview.
Metrics of success are very important because we need to assign values to our qualitative data in order to best set goals and targets to therefore better ourselves with a sense of belonging. Metrics of success to assess these radical sense of belonging values will be based on qualitative assessments mentioned before, such as surveys, city hall meetings, team responsiveness, meetings between various leaders and multiple disciplines. And these metrics that we collect can include a number of things. Namely, we can evaluate the surveys and assign quantitative values to the responses to best understand the current status of the radical belonging in order to improve. Evaluate DEI metrics within M Health Fairview to better understand the status of diversity, equity, and belonging within the organization. Specific DEI metrics to look at could include hiring, advancement, and leadership. The rate at which action is taken after a negative score from employees can also be evaluated to determine how responsive the company is to change and bettering the environment for a culture of radical belonging itself. Next slide.
So how is our idea sustainable and scalable to other healthcare settings and organizations? So once reviewing the outcomes of our implementation strategies, we can work to improve things in our own community, as was stated before, with counseling services and wellness programs, as well as town hall meetings to address the community needs and facilitated team meetings for different specialties. By having these weekly to monthly meetings, we'll be able to check in on our progress and address the ideas that still need improvement frequently. Then after testing our goals in our own community, we'll reach out to other hospitals and healthcare facilities about our results and help them to implement them in their communities as well. Ways we can do this are we can send out our community leaders that we appoint to help implement our ideas in different settings and identify leaders in different organizations that we can do training programs with so they're able to replicate it in their own communities. We can do this through Zoom or in person and have weekly or monthly meetings to check in on their progress and see if they're having any issues, and we can help to troubleshoot them. We would also invite these chosen leaders to our town hall meetings and in our facilitated team meetings to see how we're making changes in our community and hospital and to help them better do it in their own communities. The overall goal here is to address the impact that COVID-19 has on the communities and the healthcare workers and work to improve conditions for all involved. Therefore, hoping to decrease the burnout rate, improve mental health and wellness and radical belonging, as well as increase overall satisfaction in the healthcare field for both healthcare workers and for patients. We believe that by using these anonymous surveys, having town hall meetings and team-specific meetings, it will be the best way for these communities to have a voice in the matter and to help provide immediate feedback and make positive changes. Please let us know if you have any follow-up questions, and thank you for your time.